Alright, we are in the car today for two reasons. One, I think there's going to be a lot of people who stumble upon this video wanting to know the content who do not find the sound of a Harley Evolution straight piped exhaust the beautiful sound we find it to be, subscribers and myself. And the second reason, it's raining. There's the bike. Oh joy, oh rapture. Welcome to Bikebite. I'm your host, Dr. L. I look fantastic on this wide-angle lens, don't I? The premise of this series is usually I'm riding the motorcycle answering dental questions. If you have a question, comment below and I will make a video. But you probably found this video because you Googled, what is periodontitis? Which is the title I picked for this episode. So, you're probably here because you saw a dentist for the first time and you were handed a large estimate plan for something you aren't quite sure why you need. What is periodontitis? Well, you already know what periodontitis is. You just don't know that you know what it is. Everybody knows what gingivitis is, right? We hear it in commercials. We're told about it in elementary school. It's the reason why you have to floss and brush at nighttime. Picture a little kid with braces in their mouth. The gums are very puffy. And you just look at them and they bleed. Some of us have been there ourselves. Raise your hand. So, periodontitis is the more severe version of gingivitis, where it doesn't just involve your gum tissue, it now involves the bone that is the foundation of your teeth, what keeps your teeth strong and stable. Now, you're either going to be told one of four things if your dentist has used their little perioprobe and found that you have deep pockets. Out of these four things, there's two different paths. We can fix this, or we cannot fix this. So what's going on there? Let's talk about the we can fix it branch first. You've either been told you need scaling and root planing or osseous surgery with bony recontouring. The big difference between these two things is the severity of your pockets and other variables such as the condition of your gum tissue and the amount of bleeding that you have. But basically, for all intents and purposes, periodontitis is an infection in your mouth that needs treating. Now, there's juvenile and non-juvenile periodontitis. I'm not going to go into that because almost everyone who is watching this video is here to talk about non-juvenile periodontitis, the slow-acting periodontitis. Now, if ignored, over the course, usually years to decades, you will continue to lose attachment, bone. The teeth will get loose, and then you run out of options. But if you've been told you need scaling and root planing, congratulations! It's treatable in a very inexpensive and non-invasive way. If you've been told that you need osseous surgery with bony recontouring, it's a little bit more expensive, but the silver lining is we expect that you'll be able to keep your teeth. Let's talk about the path of we cannot fix this. That's going to go one of two ways. Either we're going to send you to the specialist, the periodontitis, a doctor who has gone to additional residency and education to specialize and limit their office to taking care of your gum and your bone. Most of them will also place implants. But that means we general dentists think that your condition is treatable, but we're concerned that it's not predictable enough for us to treat it for you. But congratulations, we think that you can keep your teeth long term and not land yourself into a bad option. The fourth and final is that we found you too late, and we need to start removing teeth. Now, this is bad news because once the teeth are gone, we can't put them back. Now, there are two great solutions. If you have teeth remaining, we can make you a partial, be it implant supported or tooth supported. Or if you have enough teeth, we can do traditional fixed restoration, something that stays in your mouth and does not come in and out. if we have to remove all the teeth and you do not have enough teeth to support a partial, you can go with an implant supported restoration. It's very expensive, but it's like you have your teeth again. Or if you need something more economical, there's always the denture. I've talked in previous videos about having 2 implants on the bottom. Very important to make a lower denture satisfactory. But this is the big thing I want you to take away from this video. It's very important that you have follow-up treatment every 3 months until your doctor says that they see stability and healing. There's been a few patients during my career, be it circumstances have moved them to another part of the country, and then they've moved back, but they did not follow up with the 3-month periodontal maintenance, and they really suffered for it. Listen, us dentists, when we recommend that you have periodontal treatment, we don't want you to have to go through that work multiple times. We don't want you to pay multiple times. When one of our patients has to have follow-up work, we feel like we failed you. We really take it personally. And it's so important that you come in every 3 months to not only protect your investment, but to maintain it. Now, a lot of our patients that are on 3-month recalls for periodontal maintenance end up eventually being returned to 6-month trophies. Not a deep tech cleaning at all. But in order to get to that point, we have to see stability and healing. Everyone's very individualistic. So some people can go to the 6-month recall very soon, but many patients require that 3-month follow-up. Don't look at it as an expense. Look at it as an investment to keep your teeth longer. All right, we are going to be taking Old Spanish Trail exit here from Slidell. If you're coming from New Orleans, take Old Spanish Trail, turn left, going this way. If you'd like to see us in a professional manner, here's our information. I'm done talking here. I think you have all the basic information you need. But like I said, if you have questions, put them in the comments below. Our office is on the right side down this road. Have a great day, everybody.